The year 2024 will be remembered in India not for a single event, but for a relentless, suffocating heatwave that gripped the nation for weeks on end. Streets that once bustled with life fell eerily silent during the day, as temperatures soared past 45 degrees Celsius in many regions, shattering previous records and turning cities like Delhi, Jaipur, and Lucknow into virtual furnaces. In some areas, the mercury hovered above 44 degrees for over 3 consecutive weeks, a phenomenon meteorologists described as unprecedented in both duration and intensity. This was not just another hot summer, it was a crisis that unfolded in slow motion, with each day's heat compounding the last. The Indian Meteorological Department reported that over 37 cities broke their all-time high temperature records. The land itself seemed to buckle under the relentless sun. Cracked earth, parched fields, and rivers reduced to trickles. The heatwave's persistence marked a new chapter in India's climate struggle, with rainfall deficits compounding the misery. It was the longest such event in over a decade, claiming more than 200 lives officially, though experts believe the true toll is far higher. Livelihoods vanished as crops withered and businesses shuttered. The World Meteorological Organization declared 2024 the warmest year on record, with India at the epicenter of this global crisis. "We are witnessing the fingerprints of climate change," said Dr. Meera Singh, a leading climate scientist. The heat blanketed urban centers and rural farmlands alike, pushing power grids to the brink and leaving millions without reliable electricity or water. Hospitals overflowed with patients suffering from dehydration and heat stroke. Over 44,000 cases of heat stroke were reported nationwide, overwhelming medical facilities and forcing emergency measures in several states. For the elderly, the very young, and those with chronic health conditions, the heat was a direct and immediate threat. Vulnerable communities struggled to cope, relying on makeshift solutions and community support. This crisis exposed deep-seated vulnerabilities in Indian society, laying bare the stark inequalities of climate resilience. For millions, climate change is not a distant threat, it is a present-day reality. Scientists warned that such heatwaves are likely to become more frequent, more intense, and longer-lasting as global temperatures continue to rise. "This is a wake-up call," said Dr. Rakesh Menon, a senior meteorologist. "We must adapt, or the consequences will be catastrophic." The silent scourge of extreme heat demanded a response India was unprepared to give, forcing leaders, scientists, and citizens alike to confront a new and dangerous reality. In 2024, India's prolonged agony was driven by a meteorological phenomenon called a heat dome, a term increasingly familiar to climate scientists and meteorologists worldwide. A heat dome forms when a persistent region of high pressure traps warm air beneath it, much like a lid on a pot. This high-pressure system compresses the air, causing it to heat up further and preventing cooler air from circulating in. As the sun's energy continues to bake the ground, the trapped heat intensifies, creating a feedback loop. This results in a vast dome of superheated air that can linger for days or even weeks. In 2024, the heat dome over India was exceptional in both size and duration, affecting millions and straining infrastructure. Weather maps revealed deep red zones stretching across northern and central India, a visual testament to the extreme and widespread heat. According to Dr. Roxy Matthew Cole, a climate scientist at the Indian Institute of Tropical Meteorology, heat domes not only raise temperatures, but also alter atmospheric conditions, trapping pollutants and moisture, and worsening air quality. High humidity, a byproduct of the trapped moisture, cripples the body's natural cooling mechanism, sweating, making the heat wave even deadlier. Real-world examples from the US and Europe show similar heat domes causing record-breaking temperatures, wildfires, and health crises, demonstrating that this is a global threat. The heat dome acts as a silent force, turning the very air into a threat and making outdoor activity dangerous. Experts warn that as climate change accelerates, heat domes will become more frequent and intense, signaling a future of dangerous weather extremes unless urgent action is taken. The 2024 heatwave's most insidious feature was the relentless grip of heat, even after sunset. In cities like Delhi and Lucknow, the air felt thick and unmoving, as if the day's heat had seeped into the concrete and refused to leave. Typically, the setting sun brings relief, but under the heat dome, this recovery vanished. In some neighborhoods, temperatures at midnight hovered around 34 degrees Celsius, nearly 4 degrees above the seasonal average. Night temperatures stubbornly stayed above 30 degrees Celsius, offering no respite. According to the Indian Meteorological Department, June saw the highest average nighttime lows in over a century. The lack of overnight cooling had profound physiological consequences, straining the cardiovascular system. Doctors reported a surge in patients with heat stroke and heart complications, many arriving in the early hours, unable to sleep or breathe. For the elderly and those with health conditions, this stress was often fatal. One family in Kanpur lost their grandfather after 3 sleepless nights. The hospital was overwhelmed, and help came too late. The social fabric frayed as people struggled to sleep in poorly ventilated homes. Children cried through the night, and tempers flared as exhaustion set in. Families slept on rooftops, exposing themselves to risks and sleep deprivation. "We're afraid of snakes and thieves, but it's impossible to breathe inside," said Rani, a mother of 2 in Varanasi. The phenomenon of warm nights turned a daytime hazard into a continuous siege. Power cuts made things worse, leaving entire blocks without fans or coolers. The 2024 heatwave highlighted the urgent need for infrastructure and policy to handle a world where nights offer no reprieve. For millions, the darkness brought no comfort, only a reminder that the heat was here to stay. The human cost of the heatwave was most visible in India's emergency response system. Hospitals were inundated with patients suffering from severe heat-related illnesses. Dr. Mehta, an emergency physician, described the scene as a war zone. Emergency rooms were chaotic, with patients lying in hallways as staff rushed to provide care. "We were running out of beds, out of supplies, and out of time," said Nurse Priya Sharma. The volume of cases pushed healthcare infrastructure to its limit. Statistics showed a 200% increase in heat stroke cases compared to the previous year. Doctors reported symptoms escalating with alarming speed, overwhelming the body's defenses. "We saw young, healthy individuals collapsing," noted Dr. Ramesh. Authorities set up temporary cooling centers, offering refuge from the heat. However, these centers were often overcrowded and under-resourced. Volunteers distributed water and food, but efforts felt like a drop in the ocean. "We did what we could, but it never felt like enough," said volunteer Anjali Patel. The crisis underscored the need for proactive, long-term strategies to build a resilient public health system. "We must prepare for the future," urged public health official Rajiv Kumar. The heatwave disproportionately affected women, a crisis often overlooked. Many women work in the informal sector, exposed to the sun with little protection. Cultural norms and traditional clothing compounded their vulnerability. Household chores like collecting water became more dangerous during the heatwave. Biological factors such as anemia and pregnancy increased their risk. Women often suffer in silence, normalizing symptoms and delaying medical care. The true toll on women is likely far greater than official statistics suggest. "We have no choice but to work," says Lakshmi, a street vendor. "The heat is unbearable, but if we don't work, we don't eat." In rural areas, women like Meera walk miles to fetch water, risking heat stroke. "It's a daily struggle," she shares. Dr. Sharma, a public health expert, explains, "Women are more susceptible to heat-related illnesses due to their roles and biological factors. Community initiatives are emerging to support women, but much more needs to be done to address these unique challenges." The heatwave's impact on women is a consequence of systemic gender inequalities. Research shows that women in India are more likely to suffer from heat-related illnesses due to limited access to cooling, nutrition, and healthcare. Women's roles as caregivers place them in precarious positions during crises. Many are responsible for children, the elderly, and the sick, often at the expense of their own well-being. Stories from rural Bihar reveal mothers skipping meals and water so their children can have enough. Access to healthcare is limited by gender disparities, affecting women's survival. Studies highlight that women are less likely to seek or receive timely medical help, especially in patriarchal households where their health is deprioritized. Economic precarity forces women to work in dangerous conditions, compromising health. In Delhi, female street vendors report fainting spells and heat rashes, but cannot afford to miss a day's wage. Recognizing these vulnerabilities is crucial for an equitable climate response. Grassroots organizations are documenting stories of women who walk miles for water or sleep on rooftops to escape stifling indoor heat. Policies must focus on women's unique challenges, ensuring safe and accessible resources. Research suggests that targeted relief, like women-only cooling centers and water access points, can save lives. Ignoring gendered dimensions of climate change is a moral and strategic failure. Only by listening to women's stories and acting on research can we address the invisible burdens they bear. The 2024 heatwave exposed deep-rooted systemic failures in how India tracks and responds to heat-related deaths. Investigations by independent journalists and NGOs revealed that many hospitals lack standardized protocols for recording heat as a cause of death, leading to widespread undercounting. Official statistics often miss deaths exacerbated by heat, especially among the elderly, outdoor workers, and those with pre-existing conditions. According to a Lancet study, actual heat-related mortality could be up to 5 times higher than government figures suggest. Data from civil registration systems and excess mortality analyses show a stark discrepancy. For example, in several northern states, excess deaths during the heatwave period far outstripped the official heatwave toll, raising questions about transparency and accountability. Experts like Dr. Roxy Matthew Cole, a climate scientist, warn that the lack of comprehensive heat risk assessments and real-time mortality tracking severely limits the government's ability to mount effective responses. As a result, cooling centers and emergency measures are often reactive, not proactive. Without granular data, resources are misallocated, and the most vulnerable communities remain unprotected. Despite mounting evidence, heat is still widely treated as an inconvenience rather than a grave public health emergency. This perception gap is reinforced by underreporting and lack of public awareness campaigns. The 2024 heat wave, with temperatures soaring above 48 degrees Celsius in some regions, should serve as a wake-up call for systemic overhaul. Experts urge the adoption of international best practices in heat surveillance and response. Investing in robust mortality tracking, transparent data sharing, and evidence-based heat action plans is essential, say public health analysts. Integrating climate resilience into urban planning and public health systems, as recommended by the World Health Organization, is crucial for long-term safety. Without these urgent changes, India remains dangerously exposed to the escalating threat of extreme heat. The 2024 heatwave inflicted a deep wound on India's economy, halting productivity across sectors. According to the Indian Council for Research on International Economic Relations, the country lost an estimated $100 billion in productivity due to extreme heat this year alone. Agriculture and construction, 2 of India's largest employers, were hit hardest. In Uttar Pradesh, farmer Ramesh Kumar watched his wheat crop wither, losing nearly 70% of his expected yield. "We have no savings left," he says. "The heat has destroyed our fields and our hope." In cities, office workers struggled to focus as indoor temperatures soared. Factory output in Maharashtra dropped by 15% in June, according to the Confederation of Indian Industry. For informal workers like street vendor Anita Devi, daily earnings fell from 500 rupees to less than 100. "No one comes out to buy in this heat," she explains, "and my children go hungry." The power grid strained under record demand, causing rolling blackouts in Delhi and Kolkata. Economist Dr. Priya Menon notes, "Every hour of lost electricity means millions in lost output and increased hardship for the poor." Reduced agricultural output threatened food security, inflating prices of staples like onions and tomatoes by over 40%. For millions, the heat wave meant not just discomfort, but hunger and deepening poverty. Experts warn that without urgent investment in climate adaptation, like heat-resilient infrastructure and early warning systems, India's economic future remains at risk. As Dr. Menon concludes, adapting to extreme heat is not just an environmental need, but an economic imperative for India's resilience. The 2024 heatwave was a preview of a hotter future, one that experts warn could become even more extreme if urgent action isn't taken. Climate change is increasing the frequency and intensity of heatwaves. According to leading climate scientists, by 2050, Indian cities could face up to 3 times as many days above 45 degrees Celsius. The event was a direct consequence of a warming planet. But experts say adaptation is possible. Through urban greening, reflective building materials, and accessible cooling centers. The world has warmed over 1 degree Celsius, with impacts felt now. Yet, innovative solutions, like solar-powered cooling and climate education, are already making a difference in some communities. Without emission cuts, these events will become the new normal. Experts emphasize the need for both mitigation and adaptation, urging governments to invest in resilient infrastructure. Future heatwaves will be hotter, longer, and more widespread. But with community action, like water distribution and neighborhood cooling shelters, lives can be saved. Adaptation is urgent, requiring a radical rethinking of infrastructure and policy. Cities are beginning to implement heat action plans and invest in heat-resilient design. The heatwave exposed fatal gaps in the current system, but with better preparedness, healthcare systems can save more lives in the future. This is a global crisis demanding a shared response. International cooperation and grassroots activism are both vital for building a safer future. The choice to act is ours, but the window is closing fast. With innovation, determination, and collective will, a safer, cooler future is still within reach.